This is the news in brief from the United Nations. The catastrophic flooding in Pakistan has exposed victims to major health risks, including cholera, malaria and dengue fever, the UN Health Agency WHO said on Wednesday. Some 33 million people have been affected by heavy monsoon rains that began in mid-July, and at least 1,000 people have been killed, according to latest data. As part of its immediate response, the World Health Organization announced the planned release of $10 million from its emergency fund to support work to treat the injured, deliver supplies to health facilities, and prevent the spread of infectious diseases. Nearly 900 health facilities have been damaged in Pakistan, leaving millions of people lacking access to healthcare and medical treatment in many districts. Even before this natural disaster, Pakistan reported more than 4,500 measles infections and 15 cases of wild poliovirus this year. Rains and floods have disrupted the nationwide polio vaccination campaign in affected areas, WHO noted. Staying with health issues, 1 in 2 medical centres around the world fall short on basic hygiene measures, and it's increasing the risk of people getting sick, UN experts have warned. A joint report from the World Health Organization, WHO, and the UN Children's Fund, UNICEF, found that more than 3.8 billion people seek care at these facilities, where only half offered hand-washing facilities with water and soap at toilets and at points of care. This puts them at greater risk of infection, the UN agencies said, adding that 688 million people seek care at facilities with no hygiene services at all, based on data studied from 40 countries that represented 35% of the world's population. The UN agency's warning comes despite country pledges at the 2019 World Health Assembly to strengthen water, sanitation and hygiene services in healthcare facilities. Dr. Maria Nera, director of WHO's Department of Environment, Climate Change and Health, insisted that good hygiene in healthcare settings was non-negotiable and essential to pandemic recovery, prevention and preparedness. But she added that these objectives could not happen without bigger spending on safe water, clean toilets and safely managed healthcare waste. A panel of top human rights experts at the UN said on Wednesday that Spain violated the political freedoms of 4 separatist Catalan public officials following the country's independence referendum in 2017. The finding from the Human Rights Committee relates to the suspension of former Vice President of Catalonia, Oriol Junqueras Ilvies, and 3 former ministers, ahead of their criminal conviction for their role in the region's declaration of independence. The committee, which monitors the implementation of the International Covenant on Civil and Political Rights and is made up of 18 independent human rights experts, said that the 4 politicians in question had not called for a violent uprising and therefore should not have been prosecuted for rebellion, which led to their suspension from Parliament. The defendants' conviction was later changed to sedition, which meant that their suspensions were lifted, the panel of rights experts explained. In a statement, they insisted that the safeguards against such restrictions of political rights should be applied more rigorously. Daniel Johnson, UN News.